Hello everyone, I am Dr. Shakeeb Ahrar, working as consultant neurologist at Virinchi Hospitals, Hyderabad. 29th of October every year is observed as World Stroke Day, and the theme for this year is precious time. Now, the main objective behind observing such a day is to increase the awareness amongst the masses about the common symptoms of stroke and the various treatment modalities that are available if the patient is diagnosed with a stroke. Now, to identify a patient with stroke, a mnemonic that is followed worldwide is labeled as FAST, F-A-S-T. Now, F stands for facial deviation. If the patient is asked to smile or show his teeth, you will see deviation of mouth to one side. Next, A stands for arm weakness. There is weakness of arm or there is inward deviation of arm if the patient is asked to stand with his hands outstretched. S stands for slurring of speech or loss of clarity of speech. And T stands for time, meaning it's time for the patient to be shifted to a nearest hospital. Now, once you reach the hospital and your doctors confirm the presence of stroke, they advise you an imaging modality in the form of either a CT scan or an MRI scan. Now, on the imaging, if the patient happens to have a clot, then an injection can be given called as recombinant tissue plasminogen activator. Now, this injection basically holds the capacity to dissolve the clot. Now, remember, this injection can only be given if the patient visits the hospital within the first 4.5 hours from the onset of stroke. Beyond this time, this injection is useless or in fact sometimes harmful. After 4.5 hours and within the first 24 hours from the onset of stroke, we have other treatment modality available called as mechanical thrombectomy. Now, in mechanical thrombectomy, if the patient has a large vessel occlusion with a clot, the patient is shifted to a cath lab and a catheter is passed to the concerned vessel and the clot is retrieved with the help of a stent retriever. Now, remember again, this modality can only be applied to patients presenting to the hospital within the first 24 hours from the onset of stroke. Beyond 24 hours, there is hardly anything that can be given and the treatment is usually supportive or in the form of physiotherapy. Right? Remember, time is brain, meaning with every passing minute from the onset of stroke, billions of neurons in your brain are damaged. Hence, precious time saves lives. Thank you.
Visit Virinchi Hospital for evidence-based treatment.